Hello everyone. Today we will see about the biopharmaceutics definition, absorption of drug, mechanism of drug absorption, and the factors affecting drug absorption. Then this biopharmaceutics, it is defined as the study process of factors influencing the rate and amount of drug that reaches the systemic circulation, and the use of this information to optimize the therapeutic efficacy of drug product, उसे हम बायोफार्मास्यूटिक्स कहते हैं. एब्जॉर्प्शन ऑफ द ड्रग इज़, हाँ, ये क्या होता है, मूवमेंट होती है अनचेंज ड्रग का. अनचेंज ड्रग जो है साइट ऑफ एडमिनिस्ट्रेशन से सिस्टमिक सर्कुलेशन में जब मूवमेंट होती है ड्रग का, तब उसे हम कहते हैं एब्जॉर्प्शन ऑफ ड्रग. इट इज़ नथिंग, इट इज़ डिफाइंड एज द प्रोसेस ऑफ मूवमेंट ऑफ unchanged drug from the site of administration to systemic circulation. It is also defined as process of movement of unchanged drug from the site of administration to site of measurement, that is plasma. This is the rate and extent of absorption of drug. Here it is on x-axis, it is the time, on y-axis it is plasma concentration. It is showing that when there is a slow absorption of the drug, then there is a therapeutic failure of the slowly absorbed drug. Then there is when there is rapidly absorption of drug, then it shows the therapeutic success of rapidly and completely absorbed drug. And this is the MEC is the minimum effective concentration, and below it is the therapeutic level, and above it is a therapeutic level. Advantages of this pattern, absorption pattern, it include the lesser susceptibility of drug degradation or interaction due to rapid absorption, higher blood level, and rapid onset of action, more uniform, greater reproducible therapeutic response. Three major routes which are involved for the systemic circulation. It includes the enteral route, it includes preoral, it include the preoral that is the GI, sublingual, buccal, and rectal route. GI route is the most common route. The parenteral route, it is the route of administration through or under one or more layer of skin. No absorption is required, but it is required or necessary for the extravascular parenteral route, like a subcutaneous and intramuscular. Topical route, skin, eye, intranasal, inhalational, intravaginal, and transdermal route. GI absorption of the drug. So the oral route is most common for the GI absorption of a drug. In this the cell membrane structure and physiology, it is the here it is the protein, and this is the basic structure of cell membrane. These are the proteins which are present on the outer side. Polar head is there, and the tails are non-polar, and lipid are present, and these are amphiphilic phospholipids, bilayer of lipid, and it is aqueous pore having the size of 4 to 10 angstrom. Movement of drug across the movement is drug transport. It consists of a double layer of amphiphilic phospholipid molecules, which are arranged in a fashion such that their hydrocarbon chain are oriented inward to form hydrophobic or lipophilic phase, and polar head to form inner outer hydrophilic boundaries surrounding environment. Globular protein molecules are present on either side of the hydrophilic boundaries. Mayonnaise sandwich bimolecular layer of lipid is contained between two parallel monomolecular layer of protein. Hydrophobic layer is responsible for relative permeability of polar molecules. Aqueous filled pores is responsible for inorganic ions, and small organic water soluble molecules like urea can be able to pass. GI lining absorption barrier allows the nutrients like for example we can say glucose, amino acid, fatty acid, vitamin, etc. Mechanism of the action of drug absorption, it is categorized into the three. First one is the transcellular, which is also known as intracellular transport. Paracellular is also known as intercellular transport. Vesicular transport, Mainly the absorption take place, majority of the absorption take place through the transcellular transport, and here the transcellulars means the movement or transfer of the drug from across the GI epithelium. Transcellular, it is further classified into two. One is the passive transport process, that is it include passive diffusion, pore transport, ion pair transport, and facilitated mediated diffusion. P2IF is the short form. It is used, you can use to remember it, or you can use it as a easy. It will be easy for you to remember if you recall it again. P2IF, here the P is stand for the passive diffusion, P for the pore transport, and I for the ion pair transport and facilitated mediated diffusion. Active transport, it includes the primary active transport and secondary active transport. In the primary active transport, it includes ion transporter and ABC, that is nothing but ATP binding cassette. Secondary active, it includes symport, co-transport, and symport is also known as co-transport, and second one is the antipode, it is known as counter transport. Paracellular is the second. It includes the permeation through tight junction of epithelial cells, and second is the persorption. Vesicular transport, it is also known as endocytosis. Pinocytosis is one type, and second is the phagocytosis. Pinocytosis is cell drinking, and phagocytosis is cell eating. Transcellular, here they have shown it is the movement of drug across the GI epithelium. Paracellular, it is the between the two epithelial cells, transfer of the drug. And vesicular is formation of the vesicles into the cells. In transcellular, it is the passage of drug across the GI epithelium. It is the most common transport method, and it includes three process or three steps which are involved. First is the permeation of the GI epithelial cell membrane. A lipoidal barrier is the one of the major obstacle. Second is the movement across intracellular space, that is nothing but cytosol. Permeation of lateral basolateral membrane, it is of secondary importance. Passive transport, as it does not require the energy, and there is the molecular motion is required to pass through the lipid bilayer, that is the Brownian motion. And passive diffusion, it is a non-ionic diffusion. Then more than 90% of the drug are absorbed, and driving force involved is the concentration or electrochemical gradient, and it is defined as the difference in the drug concentration on either side of the membrane. No energy source is required. During passive diffusion, the drug which is present in aqueous solution at absorption site partition and dissolve in the liquid material of membrane, and finally leave it by dissolving again in aqueous medium, this time inside of the membrane. So इसमें क्या है, fixed first law of diffusion, dq by dt equal to dA km by w upon h in the bracket cgit by c minus c. Dq by dt is the rate of diffusion. It is expressed in the amount or time. It also represents the rate of appearance of drug in blood. D is the diffusion coefficient of the drug through membrane. It is in the area oblique time. A is the surface area of the absorbing membrane for drug diffusion. It is in area. K m oblique w, it is the partition coefficient of the drug between the lipoidal membrane and the aqueous GI fluid. It does not have any unit. CGIT minus C, it is the difference in the concentration of drug in the GI fluids and the plasma. It is also known as concentration gradient, that is the amount or volume. We will see some of the characteristics. It is the downhill transport. It means that there is a drug movement. Drug moves down the concentration gradient, and it is energy independent, non-saturable. Then rate of drug transport जो होता है वो directly proportional होता है concentration gradient between the GI fluids and blood compartment. जितना ज़्यादा एरिया होगा उतना कम थिकनेस होगा मेम्ब्रेन का, उसकी वजह से फास्ट डिफ्यूजन हो जाएगा. फास्ट डिफ्यूजन होगा तो रेट ऑफ एब्जॉर्प्शन भी रैपिड हो जाएगा स्मॉल इंटेस्टाइन से एज़ कम्पेयर टू द स्टमक. जो शॉर्ट डिस्टेंस पे जो है प्रोसेस जो है रैपिड होगा और लॉन्ग डिस्टेंस पे प्रोसेस स्लोली होगा. इक्विलिब्रियम इज अटेन्ड व्हेन द कॉन्सेंट्रेशन ऑन ईदर साइड ऑफ द मेम्ब्रेन बिकम्स इक्वल. Drugs which can exist in both ionized and unionized form approach equilibrium primarily by transfer of unionized species. So in this, the rate of transfer of unionized species is 3 to 4 times the rate of ionized drugs. Greater the membrane water partition coefficient of the drug, faster the absorption. As we know that the membrane is lipoidal in nature, so the lipophilic drug will easily, or we can say faster, get diffused and it will get solubilized in the lipid layer of the membrane. The drug diffuses rapidly when the volume of the GI fluid is low. Conversely, dilution of the GI fluid, it will decrease the drug concentration in this fluid, that is CGIT, and lower the concentration gradient, and this phenomena is useful in the case of the treating the overdose, oral overdose or poisoning. Next in this is the molecular weight. It must be between 100 to 400 daltons. These are in this range only. In this these the drugs are effectively absorbed passively, and the diffusion generally decreases with increase in the molecular weight of compound. However, there is one exception. For example, cyclosporin A peptide molecular weight having a peptide of molecular weight 1200 is absorbed orally much better than that of any other peptide. Here is the initially the drug फिक्स फर्स्ट लॉ ऑफ डिफ्यूजन क्या बताता है कि ड्रग का जो ड्रग मॉलिक्यूल जो है डिफ्यूज़ होगा हाई कॉन्सेंट्रेशन से लो कॉन्सेंट्रेशन जब तक इक्विलिब्रियम जो है अटेन नहीं होता. एंड द रेट ऑफ डिफ्यूजन जो है डायरेक्टली प्रोपोर्शनल होगा कॉन्सेंट्रेशन ग्रेडियंट को जो अक्रॉस द मेम्ब्रेन. एंड ये मॉलिकुलर वेट बताया 100 to 400 Dalton. And initially when the drug is ingested, CGIT is greater than C and a large concentration is exists, thereby acting as the driving force for absorption. As equilibrium approached, drug diffusion should stop, and consequently a large fraction of the drug will remain unabsorbed. But this is not the case. Once the passively absorbed drug enters the blood, it will rapidly swept away and it will get distributed into the large volume of the body fluid. Hence, the concentration of drug at the absorption site, we can say that CGIT is maintained greater than the CGIT of the drug in plasma. This is a sink condition of the absorption. Since under usual condition of absorption, D, A, K, M by W and H are constant, the term D, A, K, M oblique K and oblique H can be replaced by a combined constant P, which is called as or known as permeability coefficient. Permeability is referred to as the ease with which a drug can penetrate or diffuse through a membrane. It is the ability of a particular drug to diffuse into the membrane or penetrate through the membrane. So it is simplified to dq by dt equal to pcgit. It is a first order process, and so we can say that passive diffusion follows the first order kinetics, since we can say that the large concentration gradient always exists at the absorption site for passive diffusion. The rate of absorption is more rapid as compared to that of rate of elimination, and this is the illustrates the relative permeability of different molecules to lipid bilayer. So hydrophobic molecule, like we can say hydrophobic molecule means lipophilic. It will get easily penetrate outside, so it is the outside to inside it will move, drug can move. and small uncharged polar molecules, it will less permeable, and large uncharged polar molecule, it will very less permeable, penetrate as compared to small uncharged polar molecules and ions, as it will not able to penetrate. So this is all about the relative passive diffusion rate of different types of molecules. Next is the pore transport. It is also known as the convective transport, bulk flow, or filtration. This mechanism is responsible for transport of molecule into the cells through the protein channels which are present in the cell membrane. Some of the characteristics of the pore transport, इसमें ड्राइविंग फोर्स कौन सा इन्वॉल्व होता है, दैट इज़ ए हाइड्रोस्टैटिक प्रेशर, जिसे हम और वी कैन से ऑस्मेटिक डिफरेंस अक्रॉस द मेम्ब्रेन, ड्यू टू विच द बल्क ऑफ फ्लो ऑफ वाटर along the small solid molecules occurs through the aqueous channels. Water flux that promotes such transport is called as solvent drag. The process is important. This process is important in absorption of low molecular weight, low molecular size. Low molecular weight means क्या था, less than 100 होगा. Low molecular size means it will lesser than the diameter of pore, and generally water soluble drugs through the narrow aqueous filled channels or pores in the membrane structure. For example, we can say urea, water, sugars. Chain like linear compounds, molecular weight up to 400 dalton can be able to absorbed by the filtration. Then this drug permeation through water filled channel is important in renal excretion, like we can say removal of the drug from the cerebrospinal fluid and entry of the drugs into the liver. नेक्स्ट इज़ द आयन पेयर ट्रांसपोर्ट. इसमें क्या होता है, लाइक कंपाउंड्स लाइक वी कैन से quaternary ammonium compound and sulfonic acid which ionize under all pH condition is ion pair transport. Despite their low oil in water partition coefficient agent, they penetrate by forming a reversible neutral complex with endogenous ion, that is endogenous ion of GIT, like we can say mucin. These have both required lipophilicity and aqueous solubility for passive diffusion. Such phenomena is known as ion pair. Propanol, a basic drug which forms an ion pair with the oleic acid. This is the GI lumen and membrane and blood. Here you can see this is a cationic drug and this is a endogenous anion, and it will form a neutral ion pair complex, and this is the passive diffusion. Here in the membrane take place the passive diffusion, and here is the in the blood dissociation of complex takes place and form the free drug. Then carrier mediated drug transport. Carrier mediated transport, specialized transport mechanism without which many essential water soluble nutrients like we can say carrier mediated transport, it is some polar drugs cross the membrane more readily than can be predicted from their concentration gradient and partition coefficient. It suggests presence of specialized transport mechanism without which many essential water soluble nutrients like monosaccharides, ammonia acids, and vitamins will be poorly absorbed. In this, generally the mechanism is thought to involve a component of the membrane that is nothing but a carrier. It generally binds reversibly or non-covalently with the solute molecules to be transported. This carrier soluble complex traverses across the membrane to other side, where it dissociates and discharges the solute molecule. The carrier then returns to its original site to complete the cycle by accepting a fresh molecule of solute. Carriers in membrane are proteins and and may be enzyme or some other components of the membrane. They are numerous in all biological membranes and found dissolved in the lipid bilayer of the membrane. Some of the characteristics of the carrier mediated transport. It includes, like we can say, it is a unidirectional, it is structure specific, then capacity limited, that is adequately described by mixed order kinetic, also called as it is also called as it is a mixed order kinetic. It is also called as the Michaelis Menten saturation or non-linear kinetics. It is a mixed order इसे कहते हैं because because it is first order at subsaturation drug concentration and apparent zero order at above saturation level. And it is capacity limited characteristics of such system suggests that bioavailability of a drug absorbed by such system decreases with increasing dose. For example, we can say vitamins like vitamin B1, B2, B12. Hence, administration of large single oral dose of such vitamins is irrational. Here it is the concentration of drug at the absorption site and the rate of the drug absorption, and the passive diffusion, it follows the first order kinetics. The area in which the carrier system is, area in which carrier system is most dense is called absorption window. Okay, absorption window. The drug absorbed through such absorption windows are poor candidates for controlled release formulation. Then next is the two types of the carrier mediated transport has been identified. One is the facilitated and the another one is the active transport. In the facilitated diffusion, we have studied that is a carrier. It is a carrier mediated transport, and it is a downhill transport. Driving force involved is the concentration gradient, no energy expenditure. Vitamin B12 is the one of the example. Then no energy is involved in this. Then example in this is the absorption of the example is vitamin B12. A classic example for this is the GI absorption of vitamin B12. Entry of glucose into the RBCs and intestinal absorption of vitamin B1 and B2. Here it is the example of a vitamin B12. An intrinsic factor IF, a glycoprotein produced by the gastric parietal cell, forms a complex with the vitamin B12, which is then transported across the intestinal membrane by a carrier system. Here it is a GI lumen, it is a vitamin B12 and intrinsic factor is there, and this is a carrier which is present in a membrane, and this is a vitamin B12 intrinsic factor carrier complex, and it will further from the membrane it will pass, and dissociation of complex take place, and free vitamin B12 will be released into the blood. Active transport, it is also known as the uphill transport. In this, there is a requirement of the energy in the form of ATP. Primary active transport, it is a direct ATP requirement, and in this the process of in this transfer, it transfer only one ion or a molecule in only one direction, so it is said to be as uniport. In this example is the absorption of the glucose. There are the two types of these carrier proteins involved in primary transport are of the two types. First one in this is the ion transport. Ion transporter क्या होता है? It is responsible for transporting ions in or outside of the cells. Example in this is ATP driven ion pump. It is a proton pump which is implicated in acidification of intracellular compartments. It is of two types, as it plays an important role in intestinal absorption of drugs. One in this is the organic here it is not mentioned. One in this is the organic is there. Organic anion transport, which aids the absorption of drugs such as we can say paravestin, atorvastatin, and organic cation transport, which aids the absorption of drugs such as diphenhydramine. Next is the ABC. It is the ATP binding cassette transporter. It is responsible for transporting small foreign molecules like we can say drugs or toxins, uh, especially out of cells. That is the absorption. And example is given, that is a p glycoprotein multi-drug resistance protein. And this p glycoprotein, it is the later is responsible for pumping hydrophobic drugs, especially anti-cancer drugs, out of the cells. The presence of large quantity of the protein thus makes the cell resistance to a variety of drugs used in cancer chemotherapy. A phenomenon is called multi-drug resistance, and it is for this reason that p glycoprotein is called multi-drug resistance protein. ABC transporter present in brain capillaries pump a wide range of drugs out of brain. Secondary active transport, there is no requirement of the energy in the form of ATP. Then symport is there. Symport, it is the movement of molecules, both the molecules in the same direction is symport. And example is the Na plus glucose symport, using the potential energy of a sodium concentration gradient to move glucose against the concentration gradient. And another example of this is the peptide transporter, that is a H plus coupled peptide transport, which is implicated in the intestinal absorption of peptide like drugs such as beta lactam antibiotics. Antipode, it is the movement of molecules in opposite direction, like we can say explosion of exclusion of H plus ion using the sodium gradient in the kidneys. So this is the diagram of this GI, lumen, membrane and blood, and in this way it is dissociation of complex will take place. Drug is there which is present in the GI lumen, it will form a complex with the carrier, and the drug carrier complex is formed. Further, the energy is there, free carrier is formed, and dissociation of complex will take place. Next, it is the different types of the transport is shown. Concentration gradient, first is the primary active transport, and these are the secondary active transport. And in this, the second one, third one is the symport, and the last one is the antipode. Like you can see that it is in the opposite direction, and in the symport both the molecules in the same direction. Endogenous substances which are transported, like we can say sodium, potassium, calcium, iron, glucose, certain amino acid and vitamins like niacin, pyroxene, ascorbic acids. Drugs having the similar structure to such agents are absorbed actively, particularly the agents useful in the cancer chemotherapy. In this example is the absorption of 5-fluorouracil and the 5-bromouracil via the pyrimidine transport system, the absorption of methyl dopa and levodopa via L-amino acid transport system, and absorption of AC inhibitor enalapril via the small peptide carrier system. These are the examples of this. And another example we can say competitive inhibition of the drug absorption via the active transport is the impaired absorption of levodopa when ingested with meals which are rich in the proteins. Active transport is important in renal and biliary excretion of many drugs and their metabolites, and secretion of certain drugs out of CNS. In this, we know that the drug is transported from the lower region to the higher concentration against the concentration gradient, as it requires the energy, so it is a upfield transport, and the process is faster as compared to that of the passive diffusion, and energy is required, and energy required in work is work done by the carrier. This is the diagrammatic comparison of active and the passive. The first one is a passive diffusion in this high concentration to the low concentration, and in the case of the active transport, it is uphill transport, that is from the low drug concentration to the high drug concentration. Endocytosis, it is the engulfing extracellular materials within a segment of the cell membrane to form a vesicle, which is also known as the vascular transport, and which is then pinched off intracellularly.